My name is Jim DeLine. I'm a member of the League of Women Voters. The League of Women Voters is a national nonpartisan organization of men and women whose purpose is to promote citizen involvement in government through active participation. And while the League doesn't endorse or oppose any political candidate or party, we do feel a need to study and take a stand on many social, economic, international, and environmental issues. This program focuses on the Lansing area efforts to help people meet their basic human needs for shelter, for food, and for access to medical care. And while the League feels that an income sufficient to purchase these necessities is also a basic need, the sheer quantity and intricacies of income assistance programs is well beyond the scope of this program. In the Lansing area, there's a unique community of agencies, both public and private, working to assist those who are having trouble meeting their basic needs. It's a somewhat loosely woven consortium of agencies. They all know each other, and they act as resources and referrals for each other and for their clients. For this program, we've interviewed representatives from a sampling of those agencies. One thing they did for us is to give us a sketch of our present situation. When you and I walk down the street in Lansing, in Holt, in East Lansing, are there people among us who actually have no place to stay, who are hungry? Well, you know, with an exception of a place on Michigan Avenue or maybe a few places downtown Lansing, we don't seem to see them.
Many people think that they should stand out from the crowd, that they look different than you and I if you're walking down the street. That's not true. They look the same as we do. Here in Lansing, hunger is evident, but it's more subtle, whereas in third world countries you see it with people with swollen bellies and that type of thing. We don't see that type of starvation here, but we do have hunger, and we're seeing it especially in children.
It's really hard to see the problem. First of all, the people that are homeless or hungry tend to look like the rest of us. They can get clothing that looks about like the clothing the rest of us wear, and you can't always tell just by looking at someone what their personal life is like. So in that sense, it can be a hidden problem.
As you know, statistics on homeless people are really hard to come by. If people are sleeping in cardboard boxes or in cars, you can't count them very well. I had a call yesterday from some housing resource center, and they had a family of 8 who were living in a van and wanted us to help house them. So it's just really estimates. We kind of figure there are 500 to 600 homeless people in Lansing at any given time.
A lot of them spend their days in environments where they are relatively safe, library. Some of the local programs have places where you can sit during the day, or some place, especially in the winter, that's relatively sheltered and warm.
You know, there are over 30,000 people in the Tri-County area that live under the poverty level. And when, you know, and that's sort of general. What's poverty level? Poverty level means that you barely have enough to pay basic needs, and a lot of times you don't even have enough for that.
It's awfully hard to generalize about someone who's receiving public assistance. Right now in Ingham County, we have nearly 28,000 human beings receiving public assistance. That's about 9.9% of the county's population. Obviously, that's a lot of people. What's important to keep in mind is almost 64% of those people are children. The children who are our state's, our communities, and our nation's future. So whatever people might want to think or believe about a public assistance recipient, and I have heard a variety of belief statements, we need to remember that most of those people are children.
Beyond shelter, it's hard to say. My feeling is that people are hungry because they're spending too much on housing. The soup kitchens are full and seem to keep growing.
As far as the shelter is concerned, we serve the greater Lansing area, and we serve about somewhere between 350 and 400 people a year. Almost half are children. We are primarily serving homeless families, which is a new group of the homeless.
We're seeing jobs, for example, which don't pay as much as they used to. People who've been laid off from manufacturing jobs who are now working at service jobs at maybe half the pay of what they used to have.
Now we're finding that we are getting more and more couples with children, people who have traditionally had jobs. Just recently, I was looking at one of our cards of a family. He had worked at BOC, and he was laid off, had unemployment. His unemployment ran out last September, and finally they used up all of their savings. Everything was depleted. They were asset poor. They couldn't get help because they had assets. They didn't have money, but they had assets, and then they lost their shelter.
They sleep in abandoned buildings, cars, whatever they can find. And there really are people who do that. You know, you don't see them. They're not very visible. Once in a while you see somebody sleeping in a garage. Occasionally I have church members who come in and say, I saw somebody sleeping in a garage downtown. But the city's tightened up on closing those, and it's harder for people to get into those places.
Over the years, we developed a network so that we're tied into St. Vincent de Paul, Salvation Army, Red Cross, Community Service and Referral Center, various churches, various community organizations, Loaves and Fishes, Economic Crisis Center, Harvest House, and so on. And if the people come to us with problems, then we've learned over the years who the best person is to serve those people.
The League of Women Voters has conducted an in-depth national study of basic human needs. And one thing they found is that when looking for assistance, it's usually very difficult to find the appropriate agency or person to talk to, or even the correct phone number to call. People don't know where to turn. They're new to this problem of being in need. Many used to have good, steady jobs. And now, with their family in crisis, they often need help plugging into the appropriate agency in the social welfare labyrinth. In the Lansing area, the network David Weiner mentioned works to address this, and we'll be giving you some key addresses and phone numbers throughout the remainder of the program. Now let's listen to some representatives talk about their individual agencies within that network. What do they do? Well, we'll start with the local county office of the Department of Social Services.
The Department of Social Services is a multi-program area. A small portion of our staff is in the child welfare area. We investigate child abuse and neglect complaints. We provide foster care to neglected children. We are also involved in serving delinquent youth. The thing that people most popularly associate with the Department of Social Services are our financial assistance programs. We administer the Aid to Dependent Children program, the General Assistance program, the Medicaid program, the Food Stamp program, and the Emergency Needs program. These are all programs targeted at providing cash assistance to people who are sufficiently poor in terms of both income and assets to qualify for those benefits.
Where does someone go if they don't meet your criteria for assistance?
Well, there's really only one other avenue for people who need regular financial assistance, and that's the Social Security Administration for either regular Social Security benefits or supplemental security income, which is a payment source for people who are aged or who are disabled but who do not have a sufficient work history to qualify for regular Social Security benefits. But in many ways, some of their eligibility criteria are more stringent than ours. So, you know, other than that, it's short-term temporary assistance from an emergency shelter or some other facility like that.
What people do when they come here is go through an intake interview with us, and in that interview we try to find out what their actual needs are. In some cases, they've been looking and they're very close to moving in somewhere, but they have to wait a few days before they can get in, or they have to wait till they get their next paycheck, or maybe the heat isn't working where they're living, but they'll be able to go back in 5 days after the landlord gets it fixed. In other cases, people come here and they're just really at the bottom. Everything's gone wrong. They haven't figured out how to get their way out of it. And what we do at that initial interview is look at the whole picture and figure out what the person's needs are. Most of the people who come to us are referred by other organizations. The organizations that people turn to when they don't know what else to do. They've used up everything they can. So they might go to the Red Cross or Salvation Army, or they may go to a minister or a priest, or they might go down to the Department of Social Services and say, help, I don't know what to do next. And those are the people that know about us. So we get most of our people through referrals. Once in a while, someone has heard about us through a friend or relative, but most of the time we get referrals from other organizations. The groups that we serve include the working poor, people who are unemployed and not making very much, often at part-time work, the people who are recently unemployed and have used up all their resources, people who are on public assistance and are having trouble finding housing that's within the range that they're allowed, which is a very low range, or people that have had some kind of crisis in their lives and everything has changed overnight for them and they're trying to get back on their feet. So there's a real wide range of people that we serve for a lot of different reasons. We're also part of the Greater Lansing Food Bank, and we're one of 36 sites that are located around the county that can dispense emergency food after the person has been cleared by the central office. So through our food bank, we're primarily serving people in the East Lansing, Okemos, Hazlet area, or occasionally we'll be able to serve someone who needs emergency food but is working until 5 o'clock when most of the other food bank locations close down. So this is a place they can come in the evening and pick up their food after work if they need it. And we're serving about 30 to 40 families a month through our food bank network, and that's, as I said, local people. We want the situation to be such that when people move out of here, they should be getting into a permanent place, getting a chance to get back on their feet and back to independence again. So our goal is to work with them as much as necessary so they can put all the pieces together. There may be financial pieces, there may be job pieces, there may be medical pieces, there may be a whole range of special needs that they have, but our hope is that once they get into a place, that will be a permanent established place for them, and they'll be able to move back to independence again and self-sufficiency.
Questor is located in the central heart of the North Lansing and basically the low-income community. The majority of the people that we serve are actually within walk-in distance, and most of them walk in. We have 11 major programs in this agency, and they're all actually been created with a certain specific need in mind. When we take a look at the clinics, for example, we have a clinic where we have two doctors. One is a family doctor, family practice. The other one's internal medicine. And when we look at them, let's say a year ago, and even close to the end of the year, they were, let's say, working 8 hours a month. Right now, they're working like 13 hours a month. What this clinic is, this health program is that we take all the ones that nobody else wants. This would be all Medicare and Medicaid people and the zero type of income people. The doctor will see anywhere from 25 to 30 patients in one morning. All of them are, I would say, either 25 or 30. You will find that maybe anywhere from 5 to 10 would have zero income, that have no money to either buy their prescriptions or even to pay the doctor. Those are automatically absorbed by the clinic. If, in fact, there's a Medicaid, Medicare, then there is a sliding scale that they work with, and but the patient itself never pays anything.
In our office, as a state representative's office, people who are unable to get help through the established systems, usually state systems, Department of Social Services, Department of Public Health, Department of Mental Health, Department of Labor, if people are having difficulty getting help through those services, they will call us and ask that we intervene, ask that we advocate for them, or whatever. Sometimes the rules are so complicated that people just have to wait for a long time before they get service. It takes 30 to 45 days, for example, to be accepted before you can receive a grant on social services. And in the meantime, you may not have any resources at all, or you may have difficulty getting So people will call us and ask if we can intervene. We we can't change the rules. Some of the rules are federal rules, some of them are state rules or laws. So what we try to do is either work with the agencies or work with other nonprofit community-based organizations in town to help provide emergency needs for people.
We can help most easily with food. And we also have a community kitchen, so that if someone is actually homeless, on Mondays and Fridays we serve a good hot meal. We can help with food from our food closet. We try and refer people into the free shelters. If there are no available spots there, then we do put them up in a motel. That's the least desirable thing, because there's no follow-up when they're in a motel. If they come back to us the next day, then we can help to get them to social services or wherever they need to go. Not that we take them there, but we can at least give them referrals and guidance and, you know, some of those support services. If they don't come back, though, the next day, if they're in a motel, then they're on their own. So it's most desirable if we can get them into some of the shelters. But the big thing is to try and help people stay in their homes. That's where the crunch comes, you know. If we can help pay a utility bill or help with a part of a month's rent or something, so that they can stay in their homes and not lose their shelter. That's one of the things that we really try to do.
We basically are a clearinghouse for families in need of emergency food, and what we would do is a family would call our office. We would do a short intake over the phone, which would be getting information from them in order to determine eligibility. Once we do that, we then refer them to a pantry that's close in their area, where they would go and pick up anywhere from overnight help to 6 days worth of food. We are not set up too much to handle families that do not have a home, because most of the foods we give do have to be prepared. So what we do with families that are homeless is usually refer them to a community kitchen or a shelter where they can get a hot meal that's already prepared for them. All the food that we have is bought with contributions. So the food bank, our office, staff-wise, we have 3 staff people, that is paid by county funds. The rest of the program relies strictly on donations. We have a budget of about $400,000 that we have to raise, and it's all community dollars that go to buy food. We spend approximately $350,000 to $375,000 per year to feed the families in Ingham County.
Most of the shelters cannot keep people during the day. Economic Crisis Center is the only one that does. Loaves and Fishes, which is 4 blocks from here, has zoning regulations which say that the people can't stay there during the day. And that's why we opened Advent House. When I first came here, they came and said, we can't keep people, the problem is especially acute on Saturdays and Sundays, when other things shut down. Why don't you open your facilities and let our folks come stay there? And that's how we started. City Rescue Mission kicks them out, and Volunteers of America kicks them out. So all those people in shelters have no place to go during the day. We have a Saturday and Sunday weekend day shelter. In the winter we're open from 9 to 6, in the summer just from 12 to 3, with a free meal provided at 1 o'clock, and we have food out all day when we're open all day, so people can always get something to eat on Saturday and Sundays. We have the house next door to Westminster Church. We rent from St. Lawrence in cooperation with them for very minimal rent, and house homeless families there. As a society, we're not responding to the needs of our people. And there's only so much that churches and other organizations can do. In many ways, we do things more efficiently than the government can. For instance, we're feeding people at Advent House for 46 cents a meal. We have a worship service on Sunday at Advent House, which has been really kind of interesting and fun for me to do. But I go around and I invite people to come, but I even have a sign downstairs which says, you know, Advent House worship, 12 p.m. Everyone invited, in parentheses, but you don't need to come to eat here. We get funding from Westminster Presbyterian Church, the 3 different judicatory levels of the National Presbyterian Church. We get federal money for food for Advent House. We are increasingly getting donations from individuals and other churches.
Michigan Protection and Advocacy is a state and federally funded private nonprofit corporation that provides advocacy services to people with developmental disabilities like mental retardation or epilepsy or cerebral palsy, and people labeled mentally ill. And basically our job is to respond to unmet need. So a person calls us with an issue that they haven't been able to resolve. We'll try and provide them with information or a contact or sometimes direct representation to try and resolve that problem. A lot of our contacts, we get about 4,000 of them a year, and a lot of them are word-of-mouth contacts. We're not big enough to provide the services that most of the people who call us need. The best thing we can do is to try to make the system function the way it's supposed to. And a lot of the calls that we get are related to situations where the system hasn't functioned for some reason. As long as that reason is related to the person's disability, we can help them.
You can help too. It's the League of Women Voters' position, based on its study, that the primary responsibility for financing programs designed to help meet the basic needs of individuals and families falls to the federal government. But there's a secondary role as well. State and local governments, as well as the private sector, should help finance food, housing, and health care programs. Your contribution doesn't necessarily have to be financial in nature. You as an individual or social organization, or even as a business entity, can help in this growing crisis in a number of ways.
I think the best way for people to help is actually a twofold process. The first is it's really important for people to get to know more. The fact that people may be watching means that they're interested in getting to know more, and I think that's really important because a lot of people just don't believe there's a problem out there. If they don't see it, they don't know it exists. And I think it's really important as a member of the community for people to really know the full range of problems that exist in the community. I think the second part of it is for people to say to themselves, what can I offer? And there are many different ways that people can be helpful. We need volunteers, and all of the other organizations need volunteers to help us with our everyday tasks, and we can use people with lots of different kinds of skills.
There's a need for a lot of support and encouragement from people. Just being good friends or neighbors. Big brothers, big sisters is a way of helping families who often are in stress.
During Christmas, of course, we have the Adopt a Family program where we try and match families who apply to us with families who want to provide the food and clothing for them.
There are needs that are one-time. For example, we have a child services program, and sometimes students come out from MSU, and maybe they'll put on a party for Halloween. That's a one-shot deal. Maybe they'll have a pizza party or roller skating party, and it will just be a Saturday afternoon. And that gives those young people, the kids, an experience that is very valuable in their life, and it might be something that they will remember for a long, long time, and it's just a one-shot experience.
You can volunteer for the Department of Social Services. We need people to help clients fill out forms. We need people to help some of our elderly and handicapped clients get to medical care. We need people with some handy person skills to go out and do home repairs for aged people. So we would love to have volunteers directly. We'd love to have people volunteer for programs operated by other agencies that serve our kids and our adults. Be a big brother, be a big sister. Do something with the Black Child and Family Institute on Genesee Street downtown.
The single most important factor in providing basic services to groups that don't have a lot of political clout is the political support of groups that do have political clout. And citizens do have political clout. I do some work with legislators, and they consider 50 letters on an issue to be an extremely important issue. And if they get 200 or 300 letters, it's one of the most important issues that they're going to deal with during the 2-year session that they're here in Lansing. And so the first thing that people should do is they should write their legislators and tell them that they support funding programs that'll take care of people's basic needs. That's the single most important thing that they can do.
I think it's also important for people to take some interest politically and through their churches in terms of what can we as a society, whether it's through government, whether it's through private organizations, how can we rebuild our society in such a way that we can take care of people's needs for emergency food, for having a roof over their head that is their own, for having the medical care they need, and for having jobs, because frankly the unemployment situation is certainly a contributing factor to the level of problem that we have. So I think part of it is deciding what you can do as an individual to further the process of making sure that this community takes care of those needs.
There's a lot of things people can do. We are always in need of volunteers in our office that would commit maybe 4 hours once a week to work in the office, working with families, doing filing, recording, that type of thing. We have openings in the warehouse where you actually do loading and unloading of food and preparing food to be sent out to families. We have that kind of need. There's always the need of working in, we have a garden project during the summer. We can always use volunteers to help glean in the summertime for fresh produce. So once we can go into the farms and pick, that way we can process that food to give to families. There's also, you can get involved in the community kitchens. Any of the shelters are always in need of families or individuals that will help.
If you're an employer and you can offer a job to an economically disadvantaged person, not only are there some tax credits in it for you, but it's an opportunity to help someone towards self-sufficiency. If you're a decision maker and you understand that 64% of our clients are kids, these are the kids who are going to be functioning in a world with my kids, with your kids. Understand that we need to make an investment in these kids, that we cannot condemn them to living at 77% of the poverty threshold, which is what the average ADC payment in Ingham County is right now, without this having some consequences for that child's development, school performance, conduct, attitude towards the world in general. That 63% of the caseload is your future and it's my future. And we as a society need to do what it takes to make the social investment in that future.
We are looking for other groups who would be interested in starting a house like we have our house for homeless families. And they could work through us or independently or whatever, but just go out and rent an apartment or a house, and we will find the people and refer them and get a committee together to help those people find permanent housing or jobs or connect with social services, whatever they need to be done.
Usually, like with the food bank, like I said, in the office, it's like once a week. And the warehousing, if you want to sort food, that can be done once a week or once every 2 weeks, how often you can come. We try to work and accommodate everybody's schedules.
We have people donating some of the personal items that people need to get reestablished. Soap and towels and sheets and bedding, dishes and pots and pans if they don't have any. If they've moved around a little bit as they've been struggling to get a place to stay, they may have left their things behind. So we do take donations of those items. Just a few minutes ago, someone brought us a blanket and some pillows, which I'm sure we'll be able to give to someone within the next week as they leave.
There are a lot of things that people in the community have been doing and can do and need to do to deal with a lot of these problems. The first thing is to contribute to the organizations that are providing these services. Most of these organizations are small-scale nonprofit organizations who are always struggling to raise the funds that they need to keep their operations going.
I think it's important for people to know that there are a lot of needs in the community, that people who volunteer and who get involved, by and large, receive much more than they give. And once a person begins to volunteer, it opens a whole new avenue within their life. Sometimes people, sit back and they think about things they'd like to do, but once they've taken that step, it gives them a whole new experience, and it opens up a whole new avenue of interacting and taking responsibility for what goes on in our community.
We have some real special needs. We're looking for an accountant who will do a free audit for us. That's something we need. We have a lot of specialized needs. We're looking for someone who will run a children's program at Advent House, particularly a Sunday school kind of a program, or maybe just teaching crafts. Some of the mothers at Advent House have banded together and to teach crafts, and that's kind of nice. But some